least one more minute as other individuals come in.
Okay, very good. Thank you.
Hi.
Okay.
I hope somebody can hear me. I'm just double checking because my IT the last couple of days has been the pits. This is Carol Park Aiden. I'm the goofball that sent out, I think, an erroneous invite. But can you hear me?
We can hear you, Carol, and no problem. Thank you.
Okay. Okay. I'm muting now, but man, am I glad that my audio is working. Oh, and by the way, I'm not doing video because of my issues.
No problem. Thank you for
I will wave at you and then go straight audio.
Okay. All right. Well, it looks like it was good waiting. We had several more that came on. So good afternoon, members of the MAG Regional. Okay. All right. This meeting is being recorded and live streamed on YouTube as a way for members of the public to participate. For those participating via Zoom, please state your name when making a comment or asking a question. I will ask that you keep your microphones on mute when you are not speaking, and we'll now begin the meeting with a roll call of all members. Steph.
Thank you, Madam Chair. Dolores D.C. Ernst. Celeste Adams.
Present.
Thank you. Zach Altman.
Here. Thank you.
Thank you. Lupe Bandine.
Present.
Thank you. Emily Karen.
Eric Snow in place of Emily.
Thank you, Eric. Joshua Clark. Allie Klein.
Good afternoon.
Allie here.
Thank you. Okay. Christine Ellis.
Here.
Thank you. Jerry Friedel.
Present.
Thank you. Cindy Garcia. Laura Guild. Christine Hahn McDonald.
Here.
Thank you. Elizabeth Herbert. Samantha Hinchy. Berdetta Hodge. Marilyn Kasanick.
Here.
Thank you. Patricia Clark.
Present.
Thank you. Sherry Loretano.
Present.
Thank you. Andrew Lefevre.
Present via Zoom.
Thank you. Kevin Mattingly.
Present.
Thank you. Amy Offenberg.
Present.
Thank you. Carol Park Aiden.
Present.
Thank you. Kristen Charlau.
Present.
Thank you. Elizabeth Saldana Urbieta. Melissa Thomas Brickhouse. Kathy Tilkey.
Here.
Thank you. And Chair Anita Norton.
Here. Thank you.
Did I
Okay.
excuse me, Chair. I apologize. Did I overlook anyone or miss anyone? Okay. Thank you, Madam Chair. You do have quorum.
All right. Thank you. Our next call, or our next item, is the call to the audience. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not for action. Members of the public comments. Do we have any comments from the
Madam Chair, we did not receive any comments on any items for today's meeting. Thank you.
Okay, thank you. Then we'll proceed to item number 3, approval of the April 30th minutes. Does any member of the council have any questions about the minutes, first of all? And hearing none, is there a motion to approve the minutes?
Jerry Friedel, so moved.
Ally Klein.
Thank
second.
you. Is there a second? Thank you. We have a first by Jerry and Ally seconding the motion. Staff, can you take a roll call vote, please?
Yes, Madam Chair. Celeste Adams.
Approve.
Thank you. Zach Altman.
Approve.
Thank you. Lupe Bandine.
Approved.
Thank you. Eric Snow on behalf of Emily Karen.
Approve.
Thank you. Joshua Clark. Ally Klein.
Approve.
Thank you. Christine Ellis.
Yay.
Thank you. Jerry Friedel.
Aye.
Thank you. Christine Hunt McDonald.
Approve.
Thank you. Mary Lynn Kasanick.
Approved.
Thank you. Patricia Clark.
Approve.
Thank you. Sherry Loretano. Andrew Lefevre.
Yeah.
Thank you. Kevin Mattingly.
Abstain.
Thank you. Amy Offenberg.
Approve.
Thank you. Carol Park Aiden.
Approve.
Thank you. Kristen Charlau.
Approved.
Thank you. Kathy Tilkey. Chair Anita Norton.
Approved.
Did I overlook? Okay, Madam Chair, the motion passes. Thank you.
Thank you. Okay, our next item is an update on the 2 domestic violence work groups. First to present is Mimi Bustia on the teen dating violence work group, and we'll follow that with Councilmember Bandine on the DV crisis workforce group. Mimi, floor is yours.
Thank you, Madam Chair. Madam Chair and members of the council, the Teen Dating Violence Work Group's current project is the development of best practices. The group hopes to develop best practices for prevention of teen dating violence and intervention once violence occurs. The document the group is working on is intended to be a reference for professionals in the field. We welcome more members of the council to join us. We are specifically looking for unique perspectives from frontline staff. As a reminder, members of the work group do not need to solely come from this council. So if you have colleagues that you know of who may provide a unique perspective, we welcome you to invite them. You can give them either my email or Kelly's, and we can get them invited to the group. A long-term project the work group is working on is planning for the Teen Dating Violence Prevention Month in February of 2024. The work group plans to start this in this upcoming August. Our next meeting is June 26th at 3 p.m. Please let me or Kelly know if you'd like to be on that invite list. And Madam Chair, that concludes my update, and I welcome any questions. Thank you.
Thank you. Do we have any questions or comments for Mimi on this? Mimi, I have a question for you, and it might help to open things up a little bit. On the best practices ideas, do we have any thus far that we're looking at? Do you know?
We haven't concluded the project yet, so we haven't fully decided on anything. As of right now, we're trying to come up with 2 separate documents. One is going to be best practices for prevention of violence. The other one's going to be intervention. We are still early on in the conversation, and we are looking at other states' best practices with this or other organizations. So we do have a list of those other best practices so we can reference them. But that's all we have right now. We don't, excuse me. We don't have anything solidified yet.
Okay, so we do have a list that some other agencies have comprised on this. Is that what you just said?
Yes, that's correct.
Is it possible for you to share some of those things with us, if not now, even just via an email, to kind of help, stir things up in the minds for those that, can kind of get an idea as to.
Yeah. Right.
Okay, I think that would help.
I think so too.
Thank you.
I can send out an email after committee with the list that we currently have.
Great. I think that would help, those to kind of get an idea as, what they're, looking for and how we can use our imagination and get more on board with it. Thank you. Okay. And next, Loopy, you ready for yours?
Okay, yes.
Thank you.
Excuse me.
Yeah.
I'm sorry, it's Kevin here. I have a question for Mimi. With regards to direct service providers joining your group. So I've made a note here to ask my staff for volunteers who might be interested in this.
Mm-hmm.
Would I have them contact you directly, or do they need to be appointed somehow through the council?
They do not need to be appointed, as long they know you, so you can connect them to me. And I can send out an email after the committee today with that list, like Chair Norton asked for. And so you can get my email that way, and you can just pass the information along and they can join the group.
Great. Thank you very much.
Thank you, Kevin.
That'd be great. Thank you. Does anyone else have any other questions or comments for Mimi on the Teen Dating Violence Work Group? Okay, now we'll proceed with an update on the Crisis Work Group. Thank you.
Thank you, Chair Norton. So we have our Future of Advocacy video that was just returned to us yesterday regarding some edits that we wanted to make to it. We now have it at an optimum 14 minutes. That's recommended by YouTube and Social Media Examiner for best performance. So we'll be looking that over, and then we'll be pleased to present that at the next regional council meeting. We also just touched back on the state JAG conference that we attended in Mesa. There were over 700 students that attended that conference, and that was our first time out, and we were really pleased with the way that went for us. So we've decided to go ahead and contact directly the Jobs for Arizona Graduates, the JAG and JAGWorks programs for Dysart Unified School District, Tolleson Union High School District, Chandler Unified, Phoenix Union High School District, and Mesa Public Schools. We also have we're set to present at the Tolleson JAGWorks Lollapalooza kickoff in August. So we'll be there for their kickoff. We did present at, and it was just myself because it was a quick presentation and it was at an elementary school. It was the career day at P.H. Gonzalez Elementary. Now, we did have a little bit of a challenge because it is elementary students. So what we did for the lower grades was just emphasize the fact that there are people that work as school counselors and therapists, and they help families work better together. So that's the way we presented it to the younger grades. But we also presented our regular information to the 7th and 8th graders, and we asked them to share that information with older brothers and sisters and their parents. So that would have been the kinds of jobs that are available and the types of types of educational opportunities at our community colleges here in Maricopa County. So we also have, I received information from Sam Hinchy to contact Ms. Tammy Rivera, Strategic Initiative Specialist at the City Phoenix Youth Violence Prevention Department, so we can talk to her about our work group presentations. We have our list of the community college career centers to begin contacting for career events. We'll be contacting the colleges of behavioral sciences at the community college and university levels to ask about setting up during their freshman new orientation events coming up. Councilmember Ellis from the city of Chandler has invited us to set up at the Chandler City Council meeting in October for Violence Awareness Month, when they're doing their proclamation, she would like us to be there, have a presence at her meeting. And also she would like us to present at the Mastering the Journey group. It's a women's group for Mastering the Journey this summer. And she would also like us to attend their October fundraising event. So I'm expecting to have quite an excellent and full calendar beginning in August and throughout the end of the year. Our next meeting will be on June the 22nd. We're inviting anyone that would like to join us to please join us at that meeting. Contact Mimi with your information so we can put you on our list. Same goes for us. If you have other persons that are interested, I have the JAG Works coordinator for the city of Tolleson that's interested in being involved with the Domestic Violence Regional Council, just as a attendee. But she would also like to join us in our crisis workforce work group. So I'm going to include her and give her Mimi's information. So I think that's it for right now. Do we have any questions? Thank you.
I have one question for you.
Okay.
You mentioned the some group from Chandler, Councilmember Ellis. I can't even think of the name that you said now.
Yeah, it's Mastering the Journey. It's called Mastering the Journey group. It's a group that
and what is that group?
Councilmember Ellis says it's a group of 40, and I think she said it would be 40 ladies that I'm not sure of the specific details, but she said it was 40 women that attend this awareness group, Mastering the Journey group. And she thought it would be good because if they are interested in volunteering, the volunteering portion of their group. And so I don't have all the details about the Mastering group, but she thought it would be a good place to come and present because it is 40 or more women that are in this group in Chandler.
Okay, could you just give a little more information?
Vice Chair Norton. Vice Chair.
Yes.
Here she is. She can help me out here.
Yeah, I'm here. I can hop on real quick and let you know. Mastering the Journey is an organization that had started a few years back to help women that are victims of domestic violence. And so what we do is that we work, excuse me, I have been on the board for almost 4 years now as a vice chair. And currently I'm just a member at large because of all of the duties that I have. But what I have continually done with them is bring in the awareness of domestic violence, and then also helping those single mom and women who have been in that path to rise up above. This year alone, I think the chair really got us to be using GCU as a part of, they have a huge warehouse where we can actually get access to things to help women move into their own apartments and different things like that. We've done a lot of classes. These 2 classes that we're going to be having, which I have invited Mag to be part of, with putting a table and bringing some material for us to allow the women. One is on financial literacy, and then the other one is being resume ready. And so those 2, we are doing them at the resource center at our police department room over there. We have about 40 women that are going to be present in both classes. It is we limited the amount because we could have way more than that, but we limited the amount because the room can only take about 75 to 100 people. So we wanted to make sure that they have space. The other thing that was mentioned concerning the presentation in October for ours is our commission. And I believe Chandler, I don't correct me if I'm wrong, but I think Chandler is the only one that have a commission, mayor appointed commission on domestic violence at this time. And that those who are on the commission, they are asking me to represent and advocate a little bit more for them to be able to do more things in Chandler. So a couple of the things we're going to be doing besides lighting City Hall purple for that week. But when we read our proclamation, we would like to do a virtual and then have other members of MAG join us that night in honor and in remembrance of those. And then we'll have a little reception on the lawn in the courtyard there at the city. And the commissioners are the one who's co-organizing all of that.
Thank you so much. That's a lot of information. What is the date for your October event?
We will be sending that to you because usually it's, I think, we have a specific date that we do it in Chandler. The proclamation is read at a meeting, at a council meeting. Miss Heather, who is my assistant, is sending everything to Vice Mayor Bannon. So she will have all of that to funnel down to Mimi, and then everybody will receive it.
Okay, thank you. I would like to get a lot more information about this group. It looks like they are, they could be really helpful, literally, not only in the work groups, but with the overall Regional Domestic Violence Council. 40 members strong. Sounds like we probably can pick up a lot of things from them that we could share and use resources throughout the county. So thank you so much for the information.
That's
thank you.
So I'll reach out to the chair, and maybe she can do a presentation to us. I'll connect her with Miss Mimi.
I think that'd be great. Thank you.
Thank you, Madam Chair.
All right. Anything else? That was good. All right. Thank you so much, Loopy and Mimi, for the updates. And our next item is an update on the Abuse and Later Life Grant with Jody Hector from DES to present. Jody, floor is yours. Thank you.
Thank you. Hi, everyone. So I have a few updates. So first, the housing specialist with the Area Agency on Aging Doves program continues to support victims of late life abuse 50 or above that need a safe place to go, including a hotel, food, and incidentals. We've been doing on an average of 10 days in the hotel if a shelter is not available. And as of April 23, the grant has funded 31 victims in hotels. The referrals are still coming in, but please continue to spread the word in your community and organizations. We really appreciate it. We will be applying for an extension in August, I believe, and then possibly a continuation grant. And both of those need to be approved by the Office of Violence Against Women at the DOJ. And so we will start that process in June. We just completed a site monitoring by the Office of Violence Against Women. And we finished that process and are waiting for a closeout letter stating that there were no findings. So that's good news. And last but not least, we're looking for partners with transitional housing facilities to temporarily place victims as another option to the hotels. Those victims sometimes have nowhere else to go after the shelter or hotel stay. So we have partnered with GAS Project Haven that will be opening up soon. And we're looking for anybody else that has any ideas or transitional or temporary housing. So I think those are all my updates. Are there any questions?
I have a question for you, Jody.
Yes.
The 31 victims that received the housing with the hotels, do you know, did we have any who we could not provide that shelter to? Did we turn anyone away?
Yes, only for age requirements. So if they did not meet, if they were not 50, obviously we could not help them. And then sometimes they stayed in a hotel for a couple of days, but a shelter was more appropriate and available. So if a shelter was available, they went into the shelter. It just depends. Every victim has their own needs. So it was different based on what they needed at that time.
Okay, well, but that's good then. We didn't turn those who were eligible. They were all met with the needs. Now we just need to get the aftercare. Thank you so much.
Yes.
Yeah, right.
Madam Chair,
any other questions?
Has her hand up.
Hi,
yes, council member.
Thanks. Hi, Jody. This is probably a dumb question, but this is the first time I've heard of your organization. Okay. And I'm wondering if there's a way I can put you in contact you can send me your information or have someone send me your information so that I can put you in contact with our resource center for two reasons. We will be having a transitional shelter in Surprise, focusing on women and children, but there's no age restriction on it, where possibly we can help out. It should be opening, I want to say any minute now. It should be June. I believe it should be opening in June. It's being managed by New Leaf, so they may already know you and all that kind of good stuff, but we will have a women and children's shelter. It's small, so we'll only have, it's a converted motel, so we have 7 rooms, but some of them are multiple rooms. So we have some 1 bedroom, some 2 bedroom, et cetera. So
okay.
I want to make sure that we're in the loop, both on the opportunity to refer to you, as well as being able to possibly be a resource going the other way if we have shelter space and it's not being utilized. So if you can work through Kelly and we can get our information back and forth to each other. Seth Dyson is our coordinator for the Health and Human Services departments, which will include this shelter, but
Okay.
I don't think he's on here. Anyone's on his call for today. So if you could help me out, we want to participate and be able to share the information both ways.
That would be great. I think Seth already has the information, but
okay,
this is the
fine.
First I've heard about the housing and Surprise. So I'm really excited.
Yeah, it's new. It's like practically almost. We probably haven't talked about it because it hasn't had its like open, but I think it's going to open in June. So.
Okay, and is the email on your name? Is that the correct email?
That goes to my house. That's fine.
Okay, that's fine. Okay.
That works.
So I will email you and Seth and send some information on how to refer, and then you can send me information on your housing. Thank you.
Perfect. Thank you.
That's awesome. Thank you, Allie. Are there any other comments or questions? Okay. All right. Thank you so much, Jody, for that update. We look forward to hearing more. Okay. And next we have, let's see if I can pronounce her name, Dr. Tina Huiwan-Trem Negron is an assistant professor in the School of Social Work and faculty of the Office of Gender-Based Violence in the Watts College of Public Service and Community Solutions at Arizona State University. In this presentation, Dr. Huiwan-Trem Negron will broadly introduce her research and then share an overview of 2 projects in Arizona. The first of which is focused on better understanding IPV among women living with HIV, and the second of which focuses on intersecting substance use, IPV, trauma, mental health, and food insecurity among economically vulnerable individuals in Arizona. Doctor, the floor is yours.
Hi, everyone. Good afternoon. I am just going to quickly screen share before I get going. And can everyone see my screen?
Yes.
Awesome. Thank you. And then I just need to figure out how to minimize this so I can see. Okay. Great. Well, hi, everyone. Good afternoon, and thank you for the invitation to share a little bit about myself, as well as some of the work that I'm engaged in locally. As the chair noted, my name is Dr. Tina Huiwan-Trem Negron, and I am a professor in the School of Social Work at ASU. Before diving into some specifics, I wanted to first sort of share a quick overview of my overarching work and background. So prior to becoming a professor, I worked in domestic violence services for many years, and I also engaged in substance use prevention work as well as community mental health work. And it was really this experience working that led me down the path of academia, because I experienced many challenges of like what we continue to see, I think, in our field, which is siloed systems where clients have to sort of navigate multiple systems to receive the care that they need. And this makes it impossibly difficult, especially for socially and economically marginalized populations. And along the way, I also became sort of curious and frustrated with how intervention programs and practices were being developed, as I frequently spent my time adapting evidence-based interventions for the communities that I was working with. So now as a researcher, Next slide, it's not working. First, my broad overview of my work. My work is focused on the experience of gender-based violence of both intimate partner as well as non-intimate partner violence among socially and economically marginalized populations of women, where I work to really try to understand what violence even means, how frequently it's occurring, and on all the positionalities that aren't always apparent and are sometimes made invisible. So, for example, a substantial amount of my mostly international work has actually been focused on better understanding the experience of intimate partner violence among women who trade sex and how it affects their health and well-being, for example. So I focus a lot on HIV risks and depression, suicide outcomes. And then the second area of my research is really focused on this idea of how different issues connect with one another and affect outcomes. We've all seen diagrams like the one that I have up here on the slide. And what research has shown is that these issues don't just coexist, they often cluster among socially and economically vulnerable populations, and they interact, resulting in disproportionately poorer outcomes. And so I'm really invested in addressing these intersections and improving care. And I do this work, as I mentioned, both within the US context as well as internationally, because these issues are local and global, and because I also didn't grow up in the US context. And so for me, it's also just personally meaningful to do this work in multiple contexts. And then the other critical thing that I wanted to share about my approach, so that as we talk about the local projects, you have a sense of sort of how I have been engaging in this work, is that all of my work is community embedded and community driven. And that again has sort of come out of my practice experience of organizations and clients being left out as part of the conversation. And so for me, everything is sort of built from the ground up. Okay, that was my fast and furious broad introduction. And so now I wanted to share with you a little bit about two projects that I am working on locally here in Arizona. So the first of which is really focused on the intersection of intimate partner violence and HIV, and specifically the experiences of intimate partner violence and HIV-specific abuse that is happening among women living with HIV. And this project was funded through ASU's Southwest Interdisciplinary Research Center via the National Institute for Minority Health and Health Disparities. And in terms of partners, I'm working with Valleywise Health and also now El Rio Health, which is located out in Tucson, who also serves a large volume of people living with HIV. And so a little bit of background about what sort of got me down this path here, because I'd done a lot of similar work internationally at the intersection of violence and HIV, is that in the US context, 1.1 million people are living with HIV, and women living with HIV are less likely to be virally suppressed and die of all causes relative to men living with HIV. And we also see gender differences in terms of HIV transmission risk itself, with the most new infections among women being attributed to heterosexual transmission. And when we look into the factors that help explain the patterns, the overlap of violence and HIV has sort of really come into central focus, both in the driver and the acquisition of HIV, as well as an impediment to engagement and success in the HIV continuum of care. What we see, and I'm sure all of you are familiar with the national rates of violence being about 1 in 3, 1 in 4, depending on which data you're looking at. And then in Arizona, it's about 40% of women. Among populations living with HIV, we see that women living with HIV, a little over half report having experienced IPV. And what we see is that women living with HIV who report a history or active intimate partner violence experience higher rates of co-infection, increased difficulty in accessing care and maintaining a medication schedule, and they achieve lower rates of viral suppression. And then when we look at Maricopa County specifically, we see that Maricopa County is one of 48 counties in the whole country that is experiencing a disproportionate number of new HIV diagnoses. And we're sort of seeing a general trend in prioritizing prevention and risk reduction of HIV and IPV, which makes a lot of sense. But what's happening is that we're also seeing a significant gap for people who are living with HIV, who are experiencing IPV in terms of responding to their needs. And then digging in a little bit deeper, we also see that there's limited quantitative research to help explain how intimate partner violence is specifically impacting one's ability to engage in the continuum of care. We've seen a great deal of qualitative work, but not as much quantitative work. And this sort of presents a challenge in terms of thinking about what do we prioritize in terms of intervention development. And so the goal of the project that I've been embarking on for the last 2+ years or so has really been to better understand how intimate partner violence and associated factors such as food insecurity, mental health, substance use, for example, come together to impact and impede engagement in the HIV continuum of care. And so again, this is a first step to a longer term goal of developing a gender and context specific intervention to address IPV among women living with HIV. And so there's a couple of aims associated with this project. And one, it's first just identifying the factors that are impeding engagement with specific attention to intimate partner violence and HIV specific abuse tactics that partners may be using. So for example, hiding medication as a form violence that is affecting women living with HIV, and then measuring how frequently these things are happening and how frequently co-occurring stressors are happening, and then examining that relationship between those two and sort of thinking, oh, well, what do we do as a next step? So in the first year of the study, I did a little bit of qualitative data collection, and granted, there is quite a bit of qualitative work that has already been done, but since there have been no actual similar studies like this in Arizona specifically, I thought it was particularly important to start from the ground up and really sort of ask women living with HIV what their experiences were in terms of interpersonal violence and specific things that their partners may be doing now or have in the past. And these interviews were conducted in English, Spanish, and Swahili. We wanted to make sure that we could also reach the refugee populations. And when working with Valleywise Health, we learned that Swahili and French are sort of two common languages that are spoken among the refugee population. I also conducted interviews with nurses, doctors, therapists, behavioral health staff, and more. And again, the goal here was to focus on identifying what the major issues are and barriers were, and the types of questions that would be important to ask in a larger survey that would be then distributed to a larger number of people. And so some common themes that emerged out of the qualitative work really was around stigma and fear, a significant amount of isolation around their HIV status, but also if they're experiencing violence, sort of like a double whammy of isolation, a real discomfort and fear of sharing about experiences of violence and HIV status as they were engaging in care. And for some women, very severe trauma histories that have not been assessed or addressed through care, and how their trauma histories are really impacting their mental health and also use and misuse of substances, and really what their journey to care looked like in terms of engagement, and what sort of for some impacted whether they stayed engaged or how they're currently engaged in care. And then also in terms of the IPV pieces, also we talked deeply around different adverse experiences with partners. And so, for example, I heard a lot about how right before women were looking to go to their doctor's appointments to engage in care, that their partners would make them late or call them names. In some cases, women reported being called HIV as their name and as a way of harming them. And then also using money that they needed for medication on other resources. So partners using the medication or taking the vehicle that they were sharing so that they couldn't make it to their appointments. And then in year 2, which is the year I'm sort of wrapping up on, I took all of this information and knowledge from conversations and put it into a quantitative survey where the goal is really measuring how frequently these different things are happening. So hiding medications, throwing them away, as well as the more traditionally measured forms of intimate partner violence and mental health, social support, and all those other sorts of things that tend to co-occur. And examining the relationship between those factors and outcomes. So we're also asking people to report their engagement, how frequently they're taking their medications, attending appointments, and what kinds of services they're engaged in, as well as co-infections. And then there is an optional medical chart review. So participants are able to consent separately if they're comfortable with it to have their medical records released. So we can also compare self-reporting to medical data. And so we have a smaller percentage, understandably, of people who are providing that level of consent. But so far, we've been having a lot of folks who are participating in the survey. And so data collection for this portion is happening with Valley West Health and El Rio Health out in Tucson. And we're actually wrapping up data collection this week. This week is our last week of data collection on the quantitative survey. So I don't have findings for this just yet, but hopefully we'll have some data soon. And I'm happy to share out a little bit about what we found. And then, of course, the next steps for me and the team is to think about what would those interventions look like, what would be most helpful given the specific types of experiences that women are having. And then also drawing on that qualitative work where I also asked some questions about that. Okay, I'm going to now shift to a second project I wanted to share that we just did complete this spring called Project Sunrise. This is a little bit different from the project that I just mentioned, but really is around these intersections in a similar way. And so this project is funded through ASU's Substance Use and Addiction Translational Research Network through the Glenn J. Sweetie family. And is in partnership with St. Vincent's de Paul of Phoenix. And this project is really focused on addressing co-occurring substance use and concurrent risks, including intimate partner violence, trauma, mental health, and food insecurity among socially and economically vulnerable populations in people in Arizona. And so a little bit background here, when we dive into the work and we're sort of looking at economically vulnerable populations, what we see is that the risk of substance use and misuse or having a substance use disorder is intensified among people living in poverty, and financial and insurance concerns often preclude individuals from seeking and accessing treatment. And what we additionally see is that there's significant overlaps with substance use and other psychosocial and biological risks, including food insecurity, adverse mental health, intimate partner violence, HIV/AIDS, that again complicates the experience of seeking care, engaging in care, and and sort of staying in care. And as I sort of broadly mentioned earlier, part of the problem is our systems and the often siloed approach that we have that I know many of us, yourselves included, are working to sort of do integration. I heard a little bit of that earlier today around connecting housing and domestic violence services. And this is especially true for people living in poverty, of having to make decisions about accessing basic resources for food, but then also having to contend with going to maybe potentially 3 other organizations to attend to psychosocial needs that are they're experiencing. And so in partnership with St. Vincent's de Paul, which serves about 14,000 individuals and families across their multiple sites in Arizona, and they provide a lot of critical services and basic needs, what they've experienced on the ground is that they do encounter a large number of clients who are reporting substance use and misuse, and often are also reporting a lot of trauma history. So we came together to sort of really see what can we do and how can we maybe build out the capacity and start to do that cross-pollination and capacity building of organizations to have sort of the internal bandwidth to respond to a range of needs, including violence, even though they're technically considered to be, they're not a violence organization, for example. And so the goal of this project is to examine the role of food insecurity in substance use alongside other co-occurring risks, including IPV. And we did this first phase through quantitative surveys with 200 clients. We did that last summer in August of last year and surveyed 200 individuals about their experiences of trauma, violence, substance use, mental health, social support. And then this January and February, we did more sort of narrowly focused focus groups on trying to understand whether the population, the community that SVDP is working with wants to see increased capacity and services on site rather than having to necessarily go to a different organization to meet their needs around substance use or trauma, for example. And so we conducted 4 focus groups with clients and really explored the needs and barriers they're experiencing in terms of accessing care and their desire for an integrated response. And then we worked with staff in March and April to sort of do the same thing in terms of what would it take to ramp up services, what can we do, what would be feasible given that their priority is different, their mission is sort of pretty clear, but how can they and to what extent could they expand their services and adapt their work and what would really be feasible so that maybe it could be also occurring at other similar serving community serving organizations. And so I'm going to fly through these slides because I know my time is running up on my 20 minutes. And so I just want to share a little bit about the demographics of the 200 people that we surveyed in terms of their gender identification, their racial, ethnic background. And what's not on the slide here is the average age of participants was about 50 years old, and that the range of age was 19 years old all the way to 78 years old. So they serve a pretty diverse population, as you can see on this slide. And then in some other quick sample demographics, we can see, I'm not going to read these all out in the interest of time, but you can see from this slide that the majority of the population endorsed having children and making less than, about half of them reported making less than $400 a month. And so this is sort of pretty significant in terms of poverty levels. And then when we looked at food and housing insecurity, what was interesting, and I think everybody, myself included, as well as SVDP, was sort of surprised, is that food insecurity was significantly high. I think many of us thought housing insecurity would be the big issue, but what we actually saw is 90% of the people we surveyed experienced severe food and resource insecurity in their past month. So, for example, about 50% of people worried that they would not have enough food. 50% of people said that they weren't able to eat their preferred foods. Over 50% reported needing to eat smaller meals. And that 70% relied on a school dining room or service organization like SVDP to get food. And then when we looked at experiences of intimate partner violence, we also, again, here in the slide, we see that 50% of the people reported experiencing violence. And then when we looked at it by gender differences, we saw a higher percentage of women reporting experiences of IPV. This is across everybody in the sample. And then similarly, we saw extremely high rates of depression, anxiety, PTSD, and also pretty high use of substances in the past year. And then the numbers for lifetime were significantly higher. And so what we learned, and this is my last slide, from the focus group. So we saw that data from the quantitative pieces, and then we sort of sat again down with both clients as well as staff in sort of separate spaces to learn more about their experiences. And what we heard really clearly is this increased desire for integration of services that are addressing multiple needs at the same time. as opposed to sort of a greater need, instead of a desire to sort of be referred to a different organization, to have people have that capacity internally. And a need for trauma-informed and trauma-focused services, especially around domestic violence and intimate partner violence, and really a real need for improved mental health services, and also addressing general life coping with the realities of being sometimes unhoused or food insecure. Okay, I flew through that. I'm going to pause there and say thank you so much, and then also answer any questions that you may have.
Negron, that was extremely informative, quite heavy when you really look at everything. Are there some comments or questions? She brought up a lot of things that should cause a lot of thought. I don't see any hands raised. Okay, thank you, doctor, so much for that. It almost, these problems are so they seem so widespread and hit so many areas that I think it's a monumental task to address this, and there's a lot of work for a lot of people to do. So thank you so much for the information. And it seems like with St. Vincent de Paul and their program, while their focus is not on domestic violence, they see that hits so much at the core of so many of the issues. And I think that those traumas relate and probably drive their clients to the alcohol use, the substance abuse, the homelessness, and there's so many areas that's touched on. I'm thinking and hoping that we can take a lot of this information and somehow utilize it to see how important first education is so important. There's got to be a place where we can start nipping this, before it gets to the place where it's at with so many lives. So thank you. One last chance for any comments or questions. Okay, I don't see any. All right, thank you very much. We'll go ahead and continue on then to the next item on the agenda, which is for discussion on which topics the Regional Domestic Violence Council members would like to include in committee meetings leading up to and during Domestic Violence Month in October. So I would really like to have some of you present some ideas. Now's the time.
I do have an idea, Chair. I know I'm not a member, but just something that came up today in another aspect of our work here at MAG. As you know, our team also manages the region's homeless dollars, federal homeless dollars. They come to us through HUD, and we are working with our homeless providers across the region. As you know, we have one of the fastest increasing rates of individuals who are experiencing homelessness in the nation right now. Lots of attention on this issue. There is another population that we don't talk as much about, and those are individuals who are fleeing domestic violence who are then going to become homeless, and how we can protect their anonymity and their children if they need to leave with children or pets, and the overlap there between domestic violence and homelessness could potentially be a focus. We are working on that in a variety of ways in other areas of our division at the moment.
Okay, yeah, and I think with having even having the shelter and surprise that's opening this month can be something that we can certainly add to that. I think with we have two meetings before, well, the second meeting coming up from today's will be on in October, and I'd like us to have something already planned before the October meeting. So if you don't have any thoughts or ideas to present right now, please send emails to Kelly or Mimi and give us your thoughts. I do think I would like to definitely get in touch with the group that Councilmember Ellis told us about in Chandler and see if there are some things from that we could actually utilize in some kind of action plan to be involved with for October. So I'll look at that and then share whatever ideas I come up with, and please share your ideas. Does anyone have any other suggestion or thought? Okay, any ideas for the next meeting? All right.
Madam Chair, we do have several.
And
pardon me. We do have several for the next meeting as well to talk about other topics that you all have brought up, including adverse childhood experiences and how that influences domestic violence. So we don't have a blank slate, which is good to know.
Right, great. Okay, thank you. Okay, and then the next item is for discussion on how the Regional Domestic Violence Council members plan to participate in future committee meetings, in person, virtual, or hybrid. I know with what we've experienced over the last several years with COVID, and I understand that having the Zoom meetings has made it somewhat perhaps easier, more convenient for many, which, no doubt it is. I think that it'd be great though if we could get back to the in-person or the hybrid. I do note that we have a lot of new members, and if you look at the website with the council, it's showing a very different council from 2 years ago. So even with that, if we even got together once or twice and got a current photo of the current council, that might be a thought. Does anyone have any suggestions or what you would like to see as far as our next meetings, in person, hybrid, virtual? Please share your thoughts.
So this is Kevin Mattingly, and I would like to voice my support for a hybrid option. I have no issue with showing up in a meeting, and happy to do so. In fact, I've yet to be to an in-person MAG meeting after 2 years. So I'd be happy to come down. But, we sometimes stretch to reach quorum, and it seems like a hybrid version is a useful tool in making sure we can do that. So I would support a hybrid.
All right. Any other thoughts? Please share.
Madam Chair, this is Councilmember Ellis, and truly, yeah, coming all the way from Chandler for me, and driving and all, I would love to come down for the meetings, but it's sometimes I have meetings so close to each other, and I'm at the office or I'm not at the office, so I'm running from one to the other, and being able to be present here is very important to me, and I want to be part. I don't just want to be on MAG DV just by name. I want to participate. I really want to contribute. So being on the meetings with a hybrid would really allow me to do that. I appreciate it if you allow me to do it.
Thank you.
Chairman,
other comments?
Chairman, this is Councilman Jerry Friedel. In fact, I would support a hybrid option as well. I'm actually in my car right now. So again, meetings are sometimes back to back, and it's tough to always get on the road and get to a location. So I appreciate the fact that if we could do a hybrid option, that would be much more flexible.
All right, thank you for your thoughts. Let's hear some more thoughts. So far, hybrid. Yes, council member, who's that? Oh, Vandine. Did you have your hand raised?
Yes, I did. Thank you, Chair Norton. I like the idea of having at least one meeting in-house that could be like a meeting and then a little bit of a mixer so that we can get to meet each other, the regional council meeting. And I like the idea of the new picture. We have an old picture that's still on the website. So a nice picture of the new regional council would be really nice. So I'd support having at least maybe one in-house for us to attend a kind of a meeting and a mixer at the same time. Thanks.
All right, thank you.
Madam Chair, if I could suggest something, it might be great to have, it sounds like hybrid is pretty much winning this vote, not to put words in anybody's mouth, but we could certainly have the MAG photographer come to perhaps the October meeting where you could all wear purple to show your support for domestic violence prevention. Get as many people in person as possible to that meeting, get some great photographs for the web. We could certainly host a mixer afterward where everybody could stay in the room and get to know each other if you haven't met, or catch up if you know each other. And it might just be a nice event to also honor that month.
That sounds like a great idea. Okay, I see a thumbs up. I
like that idea. I really like that. Yes.
All right. Is there anyone that's opposed to that idea? Okay, I don't think so. So I think, yeah, let's plan that for the October meeting, which Kelly, do you have the date for that meeting? That way we can put it on our calendars.
I sure do. Give me just 1 second.
Okay.
It would be Thursday, October 5th.
Okay.
At 2 o'clock at our office. And we will make sure to still offer that meeting hybrid for those individuals who are not able to attend in person. And we can do an online photograph as well. We can screen grab. It looks kind of like the Brady Bunch, but we have done that before during the pandemic. Get everybody to smile and capture a photo of those who are able to participate online as well.
That sounds great. All right. That's excellent. Good idea. And okay, let's see. Are there any requests by any members for an item on a future agenda outside of what we've discussed? Okay. And last, are there any comments or announcement from the membership? Okay, looks like we're done then with the agenda, and our next meeting will be Thursday, August 3rd at 2 p.m. and it will be virtual, and then the October meeting will be the hybrid in person for those who can attend, and otherwise via your phone, in your car, or however you're able to make it. Thank you, and we will adjourn. Have a great day. Bye.
Thank you.
Thank you.
Thank you.